Okay, the next thing we're going to talk about is the Y-Axis Traction Strap. The Y-Axis Traction Pull is the great equalizer. It can pull out all the stubborn angles that you're having difficulty adjusting out of the patient. So the indications for the Y-Axis Traction Strap would be global translational postures, posture number 3. Not only when the cervicals are translated on the thoracics, but when the thoracics are translated on the pelvis. The adjustive techniques sometimes cannot pull all those angles out, so you want to use the Y-axis traction strap to pull those out, get all the stubborn angles out of there. Also, when there's an acute angle in the spine, the dura will become adhesed on the acute angle side. Until you pull out those dural adhesions, you're not going to be able to correct those stubborn angles. One way to test for it is have the patient tuck their chin and then forward flex. Anywhere they have discomfort along the spine is an indication of a stubborn acute angle and a dural adhesion. You have to pull that out. The first time you pull on that, you may not get a release past that sticking point. Continue with it until you get releases all the way down to L5-S1. Once you've got a release through that sticking point, now you're going to be able to make significant changes in their posture. Some of the indications are anybody with degenerative arthritis, brittle tissue, stubborn angles. DUD angles can be tough to pull out. Sometimes there's stubborn CD angles. A DUD angle is very high priority in the health of a patient. Those are the nerves to the heart and lungs. You want to pull those DUD angles out as quick as possible because they're being threatened with heart and lung problems. So Dr. Burl Pettibon is going to demonstrate not only the indications for the Y-axis traction strap, but show you the best application and what type of patients that this would be suited for.
When you get this Y traction adjustment, it'll have instructions with it. But let me just give you a few of the parts of it. First off, this goes around the occiput, the other part here, the handles to pull on. Then we have a clevis here which ties it down, and we even have a chin strap which we don't want to use if we don't have to, which we'll see in just a moment. And it hooks on with Velcro. So there's that part of it. The next part we have here is the table, and this table then has an area where we tie the person's feet down to it. And finally, we have a fulcrum that we're going to use in some instances for people with neck problems. Now, we're not going to use this, obviously, the first time we see a person, because they might think that we went back in the dark ages and put them on the rack, because it sort of looks like that. But you're going to find that the person that has this done to them, it's like, wow, why didn't you do that before? Well, we won't tell them that we were afraid of scaring them. But the truth is, this is not going to hurt. It's going to look like we're pulling their head off, but it absolutely, if it's done right, it'll feel good. And some people say, wow, this really is a great thing. At any rate, let's get me in position. We're going to do this on Larry, and we'll have Larry sit down here, Larry. And this is Larry Fun Type. Okay, lie down your back there. And we're going to put this to whatever sort of fits him. The other thing, we're going to put his foot under here and lock it down. And if he's got a hip that is totally disproportionate, let's say this hip is really high, we might just took it on one hip, one leg, rather than both of them. But we're going to act like that he's got level hips, or just about, and now we tie this down, hook it up where they're equal, and now we've got his legs tied here. The next thing we've got then, again, like I said, is we put this on his head. Now have the patient help you with this. Make it to where it's about right. Make sure his ears aren't folded. And if he's wearing earrings, have him take those out and give them back to his wife. And then slide the clevis down on his head. And if this isn't going to fit, if he's got a head down here that's bigger than it is on top, then it would slip off. In this instance, we would then put the chin strap on him, which we would just as soon not use if we can keep from it. So we'll take this off and act like his head is going to be okay. Okay? Now, have the patient go ahead and get himself comfortable. So use your own hands to get yourself comfortable. And I'll pull this up like so, and notice that that really isn't going to work. So we're going to push this down. Now I'm going to slide back, get myself in position, because I don't believe in working very hard, okay? And now I'm going to put about 20 pounds of stress on his neck, okay? And by the time we get through, Larry started out at 6 foot tall, we'll have him 7 foot tall. We can put tennis shoes on him and get him a basketball contract, probably. Now, if we don't, then we will just go ahead and hold him here. Now, I'm going to hold him here first for about 10 seconds. And again, in this instance, I want him to breathe deep and regular and get comfortable, okay? So, there we go, make some racket, okay? And I'm going to be pulling this out. Now, I'm not going to put any tug on it or anything, just 10 seconds, and my 10 seconds is up. I'm going to let him just relax for about 10 seconds. And then next time I'm going to do it for 20 seconds. I get myself comfortable, and I could do this, or you can have anybody in the office do this. All we're doing is stretching him, okay? So 10 seconds is up. This is the 20-second stretch. Again, pull him back here, have him breathe in deep and regular, stretch him out with about 25 pounds of force, or if he says that's too much, then come off of it. It's supposed to be to his pain tolerance, but he's actually tolerating this quite good, and there is 20 seconds. Again, we let him relax off of this thing, okay? And finally this time, we will tell him we're going to do the tug at the end of this. Well, we're going to do it just before the end, and then we'll come back and put the traction back on again. But here's the other thing. Let me show you about the tug. It looks like it would be easy if I come down and then just yanked it back. I don't want to do that. I want to, and watch when I do the tug, I won't relax it any. So here we go. We're going, and this is the 45-second one, okay? So we're going to just hold it there. And again, if you're strong enough, you can do it with one hand, but usually I prefer to do it with two hands, and just hold it there. And you're going to also be feeling, and you will feel his muscles relax. Now, again, at the 45 or 40-second area, or when the muscles relax, then you can give it that little bit of a tug that we're looking at there. And a lot of times the patient will feel it clear down their low back. Now notice I didn't let off after I did it, because what I'm doing is working with muscles. Once you do any kind of a quick force, muscles have a tendency to something called the dynamic stretch reflex. They put it right back. What I'm doing is holding him where that stretch reflex can't really get a hold of me. And then I hold it the rest of the way, and for the 45 seconds, and gradually let it relax. Take it off, and then we go ahead and get him up. But let's go with one other. If we just want to isolate the neck, we can do it like this, okay? So we put the fulcrum down, and I need to put him down one click. Go back on here, have him get this to where he feels comfortable. You comfortable there? Okay. And now we do the same thing. What I'm doing here is I'm putting this force, and this is on the low neck. That would be below C5. And in this area, this is where a lot of people get injured, and a lot of the problems that come in are actually where you need to get them straightened out first. And what you'll find often in doing this is the first time you do it, you may want to use this and just concentrate on the cervicals. Then, after we do that, take this out, throw this over here, and go do the next one and concentrate, and they'll feel it down in the thoracic spine. Then, maybe the next time they come in, do the same thing, and we will find that their low back will be involved. So now we've done the various times on this. So the idea is, don't do it in the very beginning, and these would be, then we won't just do it one time, and we'll do it to the patient's pain tolerance. And there's really 4 or 3 different times you're going to do this. The main thing is when that person comes in with a number 3 posture. The number 3 posture is where the head really isn't over the pelvic girdle. So I might come in with this type of situation, or this kind. And so this person would be a pre-Torticollis patient. You can see obviously that we've got some problems there because we're holding our head one particular way. Usually that person has had ligament damage. The second one is somebody that's plateaued. You've gone up to a point, can't go any further, not making progress, and now you want to get over the hump, so to speak. And the last one would be a person that's got various kinds of pathologies. We can do it for disc problems in both the cervical and lumbar spine. We can do it with people who've got osteophytic spurring that you're having problems with. In other words, the chronic case that comes in that nothing else is really worked on, and here we work on this particular individual. The reason for the time on this is you're working with postural muscles. Postural muscles are slow twitch. They don't respond really fast. So now you've got to work with this individual and make them realize that that stretching takes time. So we're talking about time-dependent stuff, okay? So that goes through the various ways and reasons we would use the Y-traction strap. Again, when we've worked on this individual, we're going to bring him up, bring his knees up like so, bring him up and twist him around and help him get up off of the table like so, and then he can get up and walk away. Okay? That's the Y-traction.